Thanks, folks. I guess it's kind of fun to start the evening off. In the direction there, they said don't pitch your company and kind of make it entertaining. So I might have gone a little far with the Leprechaun thing, but we'll see. So our company, we're well known for making the Dr. Mike Evans whiteboard video series. We continue to do patient-facing education and do more of behavior change programs now. So what does a leprechaun mean to you? Everybody in the room might have a different image in mind. So maybe you're thinking of a happy little dancing guy. Maybe you associate that with a pot of gold. Maybe you're thinking about a sports team that you like in the States. Maybe your leprechaun's a girl. Everyone's got a whole different image of this. Maybe your leprechaun is something scary. Maybe it's you don't want to deal with it. Maybe it's you don't know much about it, and it's intimidating. And so this is very much how I think patient engagement is these days. It means something different to just about everybody. People are doing it in all different ways. And for some, it can be a very scary proposition because in many ways it takes control from, let's say, the healthcare provider's hands and brings it very much to the patient. So the extension of this is, what does patient engagement mean to you? And I won't throw everything out there because there's probably 100 different topics that it could mean. For ourselves, we do things like we interview patients. When we're developing a project, we try to do our research, find out what patients actually want. Focus groups, so if we develop a prototype, this is very much like lean startup methodology. We bring it in front of people, we get them to kick it around, what do they like, what don't they like, and we do that before we're going into full production so that we learn some of those key elements before we spend all the money and actually create something. Co-design, so this is a very tricky one. This is having people involved in determining what they're actually going to be putting into an intervention or an app or any kind of a program. And again, it's kind of handing control or sharing control with other people, and that can be a challenge for some. And testing, and so this is where, again, we bring it back to people and let them live with it a little while and tell us what they think. So patient engagement is also like teenage sex. Everybody's talking about it. And not everybody talking about it is actually doing it. So patient engagement is completely the buzzword in healthcare today. Everybody wants to be doing it. And to no fault of the organizations, not everybody is following through on this. And it takes time to get the hang of it. You learn a lot with every single project that you get into. What makes sense to people? What's the best way to share ideas with a group? Get their feedback, run a focus group. You learn every single time, and patient engagement in reality is in some senses in its infancy, and so we still do have a lot to learn about it, and from every experience. So even when things don't go well, you take from that, failing well, failing quickly, and learning from it. And so it's one of these things. When I started working with Mike Evans, he used to talk about failing well, and I came from tech startups, and I said, well, no, failure is not an option. Like you get crucified for that. With this, it was no, you're going to learn from everything. And so that is an important part, taking something from every experience. And I completely ripped this off from Andre Picard. So I heard him say this at a presentation not long ago. This is not an original idea at all. So what does patient engagement look like then? And for everybody, it's going to be different. What does the engaged patient look like? So the process of getting there is one thing. That's probably the more challenging part. But if you just flip it around, or reframe it maybe, what does that engaged patient look like? They really understand what's going on with their health. They understand what the care providers are telling them. They understand the options that are ahead of them. They take responsibility for their choices, so they're not just looking to the healthcare providers to fix them, to make this better. They realize that they've got an active role in their own health, and they need to be fulfilling that role if they want to, for their own choices in their daily life. Empowered to ask questions and assert themselves. So this is something we were talking about earlier, where a lot of patients, it can be a vulnerable position where they're learning something that's distressing to them, and they don't feel comfortable asking questions and trying to say, well, I don't understand that. Like, tell me about that again. Because I really want to understand not only what you're telling me, but what my options are. Sorry, I got 1 minute left. And confident in making decisions about their health. So that kind of ties it all together. If you're fearful and just putting your head in the sand again, then you're not actually confident in those decisions. You might be making them, but you're more making it on instinct or maybe on what the physician is telling you. And taking charge of your own health, again, that wraps it all up. So like what we can do for our health is activity, it's eating well, it's these things that happen outside of the doctor's office. And that is all of our own responsibilities. One great line I heard ages ago was a physician saying, your health is my concern, but it's your responsibility. So they are involved, but we are all driving our own individual outcomes for health. And so what does that leprechaun mean? To me, it's that strong, empowered person that is fully prepared to take on the fight. For some, it might still be that scary thing, but again, we can get there. And at the end, they're very much as the proverbial pot of gold, so that engaged patient is getting better health outcomes. And that's it. Thanks. So 2 questions? No?
Yeah, Mike, just a quick question. 1 or 2 key learnings that you've got from doing patient engagement that you want to share?
Everybody has a different perspective on it, so people talk about their own life experience, and it's funny. People will tell you a fairly long story, and sometimes they just need to get it out. They need to share what they went through. And in there's one kernel that you think is going to be applicable to a lot of people, that kind of universal experience. And so it's always in there, but you have to let people tell their whole story often to get to that point. Yeah?
What do you think a couple of the barriers are to reaching that level of patient engagement where we have that gold at the end of the rainbow, so to speak?
It's the whole process of patient engagement that's really tough. Like the interviews and focus groups in some ways, it's just scratching the surface. People talk about portals and different elements that engage the patient. So it comes from a lot of these different areas. I think kind of the key to it is we're all different. So what's going to speak to me or reach me is not going to be the same for you. So we always try to come up with like one solution that's going to work for everybody. The ideal is more of this personalized medicine, things that are going to resonate with you. And we're not just telling you what to do, you're bought in. You're saying, I'm going to make these changes because I see what it's going to do for me. And that's it. Thanks.